Thank you for being here, Hayden. So, how are you feeling today?
Feeling alright?
Perfect. So I'm just about to guide you through the adult pre-exercise screening tool. So the purpose of this screening is to ask you a series of questions to gather some information on your medical situation. So we try to identify counter-indication to exercise. It is anything that, if present, can be harmful to you when exercising.
Yeah. Alright.
Sweet. So thanks to this exercising screening tool, I'll be able to determine a proper level of exercise that you have to work at.
Yeah.
That we call intensity.
Yeah.
Good? Sweet. And most importantly, I'll determine if I need to refer you to get a medical clearance from a doctor.
Yeah. Before I start exercising, you mean?
Exactly.
Yeah.
Maybe you need to see a doctor.
Yeah. Okay.
So shall we start?
Yeah. All good.
Let's go. So there are like 3 stages. So we're gonna complete stages 1 and stages 2, and the stages 3 is it's not mandatory.
Yeah.
All right. Perfect. So the aim of the stage number 1 is to identify those individuals with a known disease or sign of symptom and disease who may be at a higher risk of an adverse event during physical activity or exercise. The stages is self-administered and self-evaluated. So let's start. Has the doctor ever told you that you have a heart condition, or have you suffered a stroke in your life?
No.
Never? Sweet. Do you ever experience unplanned pains in your chest at rest or during any physical activity?
No.
No? Sweet. Do you ever feel faint or have spells of dizziness during physical activity that cause you to lose balance?
No.
Never?
Never had
Sweet. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Perfect. If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Never. Sweet. Do you have any diagnosed muscles, bone or joints problem that you have been told you could make be worse by participating in any physical activities?
No.
None. And do you have any other medical condition that may take it dangerous for you to participate in any physical activities?
No. No medical conditions.
Perfect. Sweet. So I just need a signature from you here.
Alright. Did I pass?
You passed the test.
Alright.
That's perfect. You're super healthy.
And the date today.
That's alright. I'll take care of that later. Perfect. So we'll now go through the stage 2. So the purpose of this stage 2 is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. And this stage is to be administered by a qualified exercise professional as me. So I'll just take your age, Hayden.
Alright, I'm 23.
23 years old. So you're a male, perfect.
Yeah.
So here it's only after 45 years old that you can be a risk factor, right?
Okay.
Do you have any history of heart disease in your family?
I think my grandfather had a heart attack.
Your grandfather?
Yeah, he didn't die of it, but he had it.
Perfect. So it wasn't your father or your brother?
No, I haven't had it.
Alright, grandfather. Good. It's still alright because it's only if it's related to your father.
Yeah.
So it's no risk factors here. Do you smoke any cigarette?
Oh, no, I don't.
Perfect. How would you describe your current physical activity in terms of sedentary, light, moderate, vigorous?
Vigorous.
Vigorous, that's perfect. And what about the frequency?
I do some weight training 3 times a week.
3 times a week, that's perfect. And the duration of this weight training?
About an hour.
An hour. Perfect. So it's -1 risk factor here.
Yep.
Because you train more than 150 minutes.
Oh, okay.
That's perfect. What is your height, please?
My height is 178 centimetres.
178 centimeters.
I believe that's about 5'10". For those using the imperial system out there.
Alright, just a moment. I'll be back. Perfect. So we determined that your height was 178 centimeters, right?
Yeah.
And your weight is?
That's 84 kilos.
84 kilograms. Perfect. So this is to go through your BMI. So basically you have a BMI of 26.51, which places you underneath the 30 kilograms level. So you have not any risk factors in this one.
Okay.
Perfect. Have you been told that you have high blood pressure?
No, I haven't.
Never. Have you been told that you have high cholesterol?
No.
Never. And have you been told that you have high blood sugar? Awesome. So this gives us a -1 risk factor for the stage 2. And just 4 more questions to conclude this interview. Have you spent any time in hospital, including the admission for any medical condition, illness, injury during the last 12 months?
I fainted while at a hospital.
Yes.
And so I was submitted into the hospital there, but that was just a one-off incident.
Alright, perfect. Copy that. I just put it here.
Yeah.
So, are you currently taking a prescribed medications for any medical reason?
No medications.
Okay. No. So I assume you have not been pregnant or have given birth in the last 12 months?
No, that's not me.
That's not you. Perfect. And do you have any muscles, bone or joint pain or soreness that is made worse by a particular type of activity?
No.
Awesome. So, concluding those results, we can go to the exercise intensity guidelines. So basically, you are a -1 client risk factor, which allows you to train at, so you're part of the low risk clients. What it means is like, you are an individual that might participate in aerobic physical activity up to a vigorous or a high intensity. Alright? So, what does it mean exactly? It means you can go up to 90% of your heart rate maximum.
Yeah.
To over 7 of your RPE, which is rate perceived exertion. And most importantly, you don't need any medical clearance, which means you can undertake an exercise program today if you want.
Okay.
Sounds good to you?
Yeah, sounds good.
Thank you very much, Alan.
No worries. Cheers.
Bomba.